Let's talk Molluscum Contagiosum. Sounds scary, doesn't it? I would love to tell you a simpler word, the common word for it. Unfortunately, I don't even know any. I've heard a couple people call them water warts, but really we don't have another name besides Molluscum Contagiosum, which, although scary sounding, is not. It's a very common rash that we see in children. To give you an idea, between the ages of about 2 and maybe about 11, 12 years old, if you were to take 100 kids, at some point in that age range, probably 60% of them are going to have one or more of these Molluscum Contagiosum. They're a viral infection, and they're kind of in the wart family. To give you an idea what they look like, they're going to be a little skin-colored bump. And if you look really close, you're going to see that it has a little concavity right in the middle, almost like a volcano crater. And then as it matures over time, what will happen is a white core will start to form in the middle. Then as it starts to go away, that bump will start to get red, and people a lot of times mistake this as being infected. And then it will pop out this core. When the core comes out, then it will start to go away and then just disappear. And typically it doesn't cause any scars. Now the problem is that they're there. And they sometimes bother people. Not that they itch, they're just there. And so kids will sometimes scratch at them or squeeze on them. Or a lot of times parents think they're like acne and try to squeeze them. Unfortunately, that's the way they're spread. And so when you scratch them or rub them or squeeze them, if that core gets broken under the skin, then it's then going to form more of these. And so a lot of times we'll see several of these in a similar area. Or we'll have some and then they start to show up in different areas. And that's something that they're spreading them by scratching them. This is something that's contagious. They did get them from other children, but this isn't a reason for them to miss daycare or school because they're extremely common. Their normal lifespan's 2 weeks to 2 years, and typically as a physician, we offer benign neglect. If you leave them alone, eventually they'll go away. Every once in a while, we need to get involved, especially if they show up in areas where there's constant rubbing and trauma. So if they get underneath the arms, if they get between the legs, those are always going to be rubbing together and irritating. It can be painful, and of course they're spreading them, so they're getting more and more and more of them. So how do we treat them? Well, we treat them a lot like a wart. We may freeze them, we may try and open them up and get that core out. Sometimes we can even use some erosive therapies that we can have made by compounding pharmacies. These work moderately well. The problem is that sometimes the unsatisfying thing for us is that they're spread by trauma. And sometimes freezing them or trying to open them up causes trauma. And so it's not unusual for us to get involved in treating and sometimes make even more. The other thing is we don't really want to cause any excessive trauma that might lead to scarring. We know that leaving them alone, they won't scar, but sometimes when we do stuff, they do scar. So I tend to leave them alone when they're on the face because I definitely don't want a scar on the face. But when they're in those areas that are spreading quickly, sometimes we have to get involved, especially in kids that have underlying skin disorders like eczema, where they always have open spots that it's easy for it to get into. So occasionally we will get involved if they're spreading very quickly. If your child's having pain with them, then you can seek your physician's help. But if you're seeing these, they're very, very common and they'll typically go away on their own.